Hello everyone, welcome to my channel. It's great to see Chinese and American netizens finally getting a chance to engage directly with each other. Many Chinese people have long heard about aspects of American life, like healthcare, education, and wages. I believe Americans are also quite curious about life in China. However, when discussing certain topics, we sometimes overlook objective facts, leading to an imbalance of information. The goal of this channel is to give foreigners a clearer understanding of China from a Chinese perspective. I will provide news and reports to support the information I share, and you are welcome to verify the details I mention with your friends in China or followers on platforms like Xiaohongshu or Douyin. Today, let's talk about healthcare in China and US. I've noticed many discussions about the topics on Xiaohongshu. First, let's acknowledge that the information from both sides is generally true. Okay? Healthcare costs in US, especially in emergency rooms and for surgeries without private insurance, can be extremely high. Meanwhile, some medical treatments in China are much cheaper by comparison. However, before you praise Chinese healthcare system, there are some objective factors to consider. Number one, different systems and concepts. In US, if you are sick and it's not life-threatening, you typically see a family doctor or general practice first. While in China, if you feel unwell, in most cases, the hospital is the only option. So, you cannot directly compare US emergency room costs to Chinese hospital fees. In China, emergency and outpatient departments take on many of the roles of family doctors in Western countries. Moreover, many people don't realize that certain emergency services in China offer VIP options, where you can pay extra to skip the line. Without money, you could end up waiting much longer. In outpatient clinics, seeing a specialist often means checking in early in the morning just to make an appointment. The specialist will call your name in the waiting room when it's your turn. If you miss the call, you would miss your turn. So, most people choose to stay in the waiting room the whole time. According to media reports, Chinese patients spend an average of 177 minutes for a hospital visit, with over 75% of time spent waiting in line. Face-to-face communication with doctors often lasts less than 10 minutes. This is much longer than the waiting time for a GP appointment or emergency care in Western countries. Additionally, overcrowded facilities in China are a real issue. I remember when I was a child, I sometimes had to lie on temporary beds in hospital lobbies to receive IV drips because there are too many people. Others would sit on benches in waiting areas for their IVs. This lack of privacy is often attributed to high patient volumes. The Chinese government clearly has resources to build more and better hospitals, but prioritizes initiatives like foreign aid instead. Number two, payment upfront versus treatment first. Many Americans complain about receiving massive bills after emergency treatment. It's true that some treatments like dental care or surgeries are more affordable in China. However, there's a catch. Most Chinese hospitals require patients to pay at least a portion of fees upfront before treatment begins. If you don't have the money, you could be denied, something that doesn't happen in the Western countries. There are numerous news stories in China about patients being turned away because they could not afford the cost. At one point, some hospitals in China implemented a treat first, pay later policy. But widespread unpaid bills forced many hospitals to revert to upfront payment. Number 3. Hidden costs and red envelopes. When undergoing surgery in China, there are often hidden costs, like giving red envelopes, which means cash, to lead surgeon, head nurse, anesthetist, or even support staff. This practice doesn't exist in Western countries. Although there are official policies against it, red envelopes or variations like mobile phone top-ups or flying night fee for skilled surgeons are still common in many places. Number 4. Concerns about the quality of domestic medical products. With recent changes in China's centralized medicine procurement policy, original imported medicines have been largely replaced by Chinese generic medicines in public hospitals. While these generics are cheaper, their effectiveness is often questioned. If a patient wants to use fully imported medicine, the same ones used in Western hospitals, the cost can be extremely high for average Chinese family, and sometimes you have to go to private hospitals to have access to these medicines. Number 5. Overuse of antibiotics. Antibiotic overuse is a significant problem in China, especially in pediatrics and surgery. Over 95% of surgical procedures involve antibiotics. When I was a child, a fever or cold often led to IV drips and injections. To be fair, not every Chinese medical experience involves these issues, and some problems like red envelope practice have improved in certain regions. Some hospitals also provide online check-in platform to save patients from physically waiting in the hospital. However, given China's large population, many people still encounter these challenges. These are important factors to consider when comparing healthcare system in China and Western countries.